West Africa is in the so-called meningitis belt, where the deadly disease meningitis has affected 1 million people since 1988. Over the last 10 years, scientists have developed a vaccine they hope will eliminate the disease. It's called MenAfriVac. The flexibility of the new vaccine means that even the most remote nomadic communities can be reached. But there's a major obstacle to the success of any new medical initiative that has nothing to do with logistics or clinical effectiveness.
When anything new happens, there are always worries and rumors, and so it's part of life that you are worried when something new comes. However, whenever a rumor occurred, we were able to strongly show the evidence that this was unfounded.
Overcoming the suspicion of a community is vital to ensure the widespread acceptance of vaccination and to prevent these crises occurring. Dr. Samboso's team in Mali have been running clinical trials on MenAfriVac over the last 8 years. He realized the importance of working with women to allay their concerns.
Every time you're talking about introducing a new vaccine, you're talking about training vaccinators, training the field workers, and training families, parents, on what is a vaccine, what is the importance of a vaccination. The first children who will be vaccinated will be my own children. So if it's something not safe, I don't know why I would take my own babies to receive this. So these vaccines are absolutely very safe.
At a community meeting in Mali, some of the mothers who Dr. So had been working with came to share their experiences. Their decision to ignore rumours surrounding the vaccine hadn't been easy.
Ambora bumubala amese so jigoro ninga munyala jo kana nande joli fere ode kacha do ka ame joli fere do ka ame na ube bolochi ande ute wolo akoma ka mangene nyele banana di parce de pinga fichini nya fosi sama delika bana.
Far from selling blood, it was essential to test blood plasma from clinical trial participants to see how well the vaccine had worked. Serum samples were sent to this laboratory in the United Kingdom, which is the globally recognised lab for meningococcal serology.
The tests basically showed that before vaccination, the individual serum was not killing the bacteria, but after vaccination, there was very high levels of killing in the serum. And this is really quite crucial. To license a vaccine, you need to show high levels of killing in the individual serum. It's absolutely crucial that the blood samples are tested, and once they are tested, they're always either returned to the originating sites or, if asked, destroyed on site.
Religious leaders also played a key part in dispelling harmful rumours. At a launch for the vaccine in Mauritania, street theatre was used to convince people of the safety and efficacy of modern medicine. The play shows a traditional healer using herbal remedies on a meningitis patient. At last, an ambulance is called and the patient is rushed into hospital in an attempt to save his life. But just as important was the presence of the Minister of Health, who had travelled all the way from the capital city to attend the launch. His very public support for the vaccination campaign would be instrumental in the programme's success. Elders were also brought into the campaign to share their positive experience that any community can be convinced if properly informed.
دخلت مشروع للسيدة ولاية التراسة هون اللي مولينا أمريكا تكوننا فيه من سنتين متقطع من الوفاة هم عاطينا رخص ما هي مادة أقل مجزئ من البادية قال لي ما عندهم اعتبار للصحة ولا يتقوا ذاك اللي يتقوا الصحيين ولا واعر عليهم التنظيم ولذاك من الناس اللي مكذب ذاك عقب يقيمك وقتل اللي
احنا هذا كمجتمع مدني.
And all means of communication, from the traditional to the modern, are employed to spread the message.
تحسيس عن طريق ايش؟
عن طريق تليفون مساج.
عن طريق تليفون.
At the community meeting in Mali, Dr. Samba Sow watches on as traditional hunters dance. Considered to be protectors of the community, their presence at the meeting shows that the vaccine has been accepted.
I'm starting to see the end of the tunnel. I'm starting to see the sun. Because I have seen children dying from meningitis in this country, not a long time ago. And I know that this vaccine is a very good vaccine.
Dr. Samba Sow is asked to dance, a final seal of approval. He too can protect the community with the new vaccine.